Mother-to-child transmission of HIV, also known as MTCT, focusing in on the countries Thailand and Nigeria. The background history on HIV, known as the human immunodeficiency virus, is a disease that spreads through certain body fluids, such as blood and semen, that attacks the body's immune system. Once HIV is acquired, it will destroy as many T cells as it can and makes it impossible for the body to defend against bacteria, viruses, and other ailments. Opportunist infections, or known as OIs, and cancers can take advantage of the attacked and weakened immune system of the HIV-positive person, which leads to them acquiring AIDS, also known as acquired immunodeficiency syndrome. It has been discovered by scientists that HIV originated from a chimpanzee disease in Africa known as the simian immunodeficiency virus, or SIV, which was transmitted to humans via infected blood. It is thought that the simian immunodeficiency virus has mutated into what HIV is today. HIV is dated back to the late 1800s, where it originated across Africa and eventually spread throughout the entire globe. The transmission of human immunodeficiency virus from an HIV-positive mother to her baby while in utero, during labor, during delivery, or while breastfeeding the child is known as mother-to-child transmission. An intervention has been discovered to reduce the risk of transferring the virus from mother to child. With the prevention in place, the risk drops from about 15 to 45% risk to 5% risk. The demographics of Thailand and Nigeria are as follows. Thailand has 450,000 people living with HIV as of 2014. As of 2016, it was eliminated the mother-to-child transmission of HIV. Their population is 68,414,135 people. The primary religions practiced in Thailand are Buddhism and then Muslim. The geography is that it's located in Southeastern Asia. The primary ethnicity in Thailand is 97.5% Thai and a little over 1% Burmese. Nigeria has 3.2 million people living with HIV. It accounts for 30% of the global mother-to-child transmission of HIV. 75,000 new infant HIV transmissions a year occur in Nigeria. Its total population is 190,632,261 people. The primary religions practiced are Muslim, Christian, and indigenous beliefs. The geography is that it's located in West Africa. Its ethnicity is composed over 250 different groups. The culture of Nigerian women is that they are the primary caregivers in regard to children and the elderly. They are submissive to their male counterparts in relationships and in the community. People of Nigeria are often exposed to poverty, poor living conditions and sanitation, lack of education, especially in regard to women, and lack of access to health care, including clinics, doctors, hospitals, and a lack of transportation to said health care. Prevention of mother-to-child transmission, also known as PMTCT. The guidelines are as follows. Earlier antiretroviral therapy, ART, for a larger group of HIV-positive pregnant women to benefit both the health of the mother and prevent HIV transmission to her child during pregnancy and breastfeeding. Longer provision of ARV prophylaxis for HIV-positive pregnant women with relatively strong immune systems who do not need ART for their own health. This would reduce the risk of HIV transmission from mother to child. Provisions of ARV prophylaxis to the mother or child to reduce the risk of HIV transmission during the breastfeeding period. For the first time, there is enough evidence for the World Health Organization, also known as WHO, to recommend ARVs while breastfeeding. Previously, there was not enough research to support breastfeeding and receiving ARVs. Globally, there are still more than 1.4 million pregnant women with HIV. There's an estimated 76% of those who receive the ARV drugs to prevent mother-to-child transmission, still leaving almost a quarter of the HIV pregnant women eligible to transmit the disease to their child. Thailand's success in the elimination of MTCT of HIV. What led to their success was a strong support from the government, including funding, integrated prevention of mother-to-child transmission interventions into maternal and child health services free of charge. Infants exposed to HIV are monitored until the age of 18 months if they were breastfed. Quality assured diagnostic services for HIV were accessible and provided free of charge. Almost 8,000 estimated new HIV infections, 450,000 people living with HIV, 1.2 estimated HIV prevalence among adults 15 to 49 years of age, and 19,000 estimated AIDS-related deaths each year. With these four stats, and still Thailand was able to completely eliminate mother-to-child transmission of HIV and prevent the child from inevitably contracting AIDS if they were to contract HIV from their mother. Integration of the MTCT of HIV. With a strong governmental support system and adequate funding, the system Thailand used to eliminate mother-to-child transmission of HIV can be implemented in Nigeria to lower the incidence rate of HIV transmission from mother to child and eventually eliminate it altogether. This system can also be implemented in the other hundreds of countries that are faced with the HIV mother-to-child transmission epidemic.